would just want to say that the Honorable Minister of Health and Social Welfare should know that just like defense budget in America and England, they're talking about very high defense budget. They're looking at your strength. The NCDC is when the executive director he visited Bauchi State last year. He told us that the budget for NCDC is only 2 billion, while in primary healthcare have 16 billion budget. So there's no, the NCDC is being suffocated of funding to carry out activity throughout the country. And there are a lot of outbreak of disease, particularly yellow fever, cholera, Lassa, measles outbreak. In the whole of this year, we are having outbreak in Bauchi and other places. The NCDC need to be empowered with funding and so that they can buy a lot of supplies, and then they're only coming to Bauchi to actually give us technical support. Training. They will bring only small supply because they are suffocated with funding. So in America, they are talking about defense budget to protect themselves. The NCDC should be protected and give them funding to carry out this work they are doing at the center so as to monitor this process. And the technical working group is already being set at the NCDC. And then at the state level, we are doing the same thing. And then at the local government level, the technical working group has been set. So we should also do before the next outbreak that occur, we'll have planned the what you call the incident action plan, which we have done in Bauchi State. And our supplies are already intact. All our partners brought their supply in one place. And then we plan what to do any time there's an outbreak. The MSF is actually trying to and waiting that is there any outbreak. The action against hunger is even waiting. Why is the outbreak now? Has it occurred? We really appreciate our partners during this activity. But our own organization, the NCDC, the MPSCD, on the other hand, has been funding. The budget is so good. And the budget of NCDC is a chicken chain. I just laugh at him. I said, this budget cannot control infection in the country. So we need to look at the reality on ground. The outbreak is getting more and more because of the economy, because of the sort of inflation that is going on. People are getting more poverty in the land, a lot of trouble, no water supplies. People, even the such water that is very cheap, such water that you can buy and drink, it's an essential commodity now. Also, household cannot get such water. So it's we're really in a big mess that we need to look at this kind of outbreak of disease where it is preventable. All the ones that we mentioned are preventable. I think I will commend NTA for actually always coming to enlighten the public about the disease that's preventable, and that the government should also come to align with their responsibility. We should also take in along our leaders, our religious leaders, and the people here are religious leaders more than our traditional rulers. We need to inform our religious leaders during sermon. They should talk to the public about cleanness of the environment, cleanness of the water they are going to drink. If they're doubting of the water they are taking, please, they should boil the water. It's very important that even if you are looking for something to boil the water, the whole of the town, they cut all the trees they are using firewood and charcoal. I don't know one day when we are going to look for air to breathe because all the tree has been cut down because the cooking gas is very expensive. Government should be aligned to their responsibility to support, and the public should also try to support the government by not dumping refuse anywhere they want to dump refuse. They dump refuse anywhere they want to, and then there's outbreak, there's a flooding going on in the community. People are now sunk, and the people are dying and then getting infected with cholera and other infections. It's very important that we should enlighten our public about cholera, which is preventable. The vaccine is not for lifetime vaccine. The cholera vaccine is given during outbreak, and it's only being given by the RCG through WHO. You apply, you get the supply, and then you give out. But as the doctor said, the doctor mentioned, the FCT doctor said, that if you give this vaccine, I'm sure the first thing that controls the cholera in Nigeria today is the vaccine. Because at the time we started the vaccine, 1.5 million vaccine that we got from the WHO, when we did the vaccine, all cholera outbreak came down. But it's not a lifetime vaccine. We really appreciate this enlightenment to the public.
All right.